So we have about 3 minutes left. I'm going to get everything going, including um, improving the transcript and everything. So I'm very, very grateful that I'm learning to improve my game. And we have 2 minutes left. So I will wait for 2 minutes and then start from there. And it's still 2 minutes. And if I look to my one side, it just I have a second computer screen that helps me to keep everything, inform me of everything, because what that's going to help actually is going to um, go to, like, if people pose questions, I want to be able to see it in real time. So I'm doing that, and then okay, I think there's one viewer who arrived, and we'll get started very, very shortly. And we have 1 minute left, and I have, I think that looks like we're on, and then I just have to open one more screen so that I can see the question and answer section of the group, and then I want to close everything else. And, and we're on time. If there's any questions, I love to take a look at the questions first, and if there's no questions, then I will read through the Facebook group page and just talk about the questions that were posted in the group. So first of all, I thank you so much. This is your precious Saturday, our precious Saturday morning, and so much appreciate people joining. And let me, unless there are questions, let me go ahead um, and let's see if last time the questions all came up, but I don't see them. Another way would be, like last time I saw the question. Okay, so I see the comments up here. Please write in questions. So you can put it in the comment section of the video, and then you can write in the question. So there's a question about my doctor does not do microdosing. He does 1.5 to 3 to 4.5 milligram. Um, at first two, and then the person says that I'm in the day 3 of 3 milligram, and I haven't slept in 3 days, and I have terrible headache and diarrhea and nausea. I don't feel any pain relief. I just have more problems. So I think it's really, really terrible for me to say, but I think this is really an example of uneducated use of LDN. So let me address some things. After COVID, I have noticed that I'm seeing more and more people who get insomnia with LDN. So this person doesn't want to do microdosing, which, in my opinion, in today's day and age, post-COVID, I think everyone's immune system has been jacked up, and I'm seeing people getting insomnia from LDN, headaches from LDN. That's a side effect. Diarrhea actually is a side effect because LDN is prokinetic, or it makes your gut things move better. That's one of the reasons why for SIBO LDN works really well. And then it says that the person has nausea, and there's no pain relief. So this is an example of as my son, when he was smaller, he had a saying, bad stupid. And so this would be an example of what bad stupid way of doing LDN looks like. Is very aggressive LDN, and it it doesn't really it's not helping the patient. There's side effect, but he doesn't believe in microdosing. You don't have to believe in it, but you do have to know that there's an optimal dose. And we published LDN primer, which I think needs to be updated for 2006 to include the optimal dosing. But it's very very simple. You ask the patient, um, like, have you had this condition for a long time? Um, and do you have lots of energy? And how do you sleep? They're functional questions, and the more you get the idea that that the person is in um, not in the best vitality mode, you just drop it by 10 to the minus 1, 0.1 milligram. And then if the person has two issues or two concerns that come up, 10 to the minus 2 or 0.01 milligram. Or if the person is really affected by the condition, like many people are these days with multiple conditions, immune derangement syndrome or mast cell activation syndrome, then you just start them on 10 to the minus 3 or 1 microgram. It's very easy. And we have an article that people can look at. So liquid versus tablet, I think this is like an eternal question that people have. And I don't think, I think it just like if someone is super sensitive, I like the liquid, or I'll ask the person to consider learn how to dilute or how to uh, prepare their own dilutions beyond 1 microgram, just because there is not yet ability to make less than 1 microgram naltrexone in the U.S. Um, pros and cons. I think the liquids don't last as long, therefore it becomes more expensive. But the pro is that it's easier to handle it, dilute it, and then usually there's no taste. But I'm noticing that even the liquids these days have fillers, and then what happens is that if you're sensitive to that filler, then you just don't have, you just have problems. So next one is on community calls, SKOOL, or school. And it's really really neat because we are learning, we are preparing. And what we are seeing is that the Facebook rules about the just the terms of use, or the community standard is getting harder and harder enforcement, and it's done by bots. And then um, we are seeing more and more health groups get affected by it. So two strategies. One is that we love Facebook. Facebook is really mature platform, so we want to stay here. But we are also looking at maybe finding another place to have a continuation plan. And one of them is our website, which is www.ldnsupportgroup.org. And that's where you've gotten your free LDN primers or LDN sample letters, because they're all hosted there. And I'm collecting email addresses because I don't know when we are able to, um, we will be asked to leave this area, or they'll just shut us down like it has happened to other groups. And we would like to prevent that, or so we want to follow the rules. If we cannot follow the rules and somehow outside control happens, then I don't. I want to be ready. So this is just in case feature that we have, but not. We love Facebook, and we're not happy with the AI bots being zealously doing things, but otherwise, um, still very very grateful. So and Maria was here. I'm so grateful to Maria. She's really an amazing supporter, and we're very very grateful that people like Maria are here, and they are making it possible, and want us to continue. So it's talking about, like, this person is an ultra low dose MCAS 0.5 milligram sublingual. So for your information, that's 50 microgram, and at least I don't consider that ultra low dose. To me, ultra low dose is really 1 microgram, maybe to 10 microgram. But I think there are people who react to even 1 microgram. So if people are having issues at 50 microgram in my practice, again, this is not a medical advice. This is just education. What do I do in my practice? If people are having problems with 50 microgram, then maybe go down to 1 microgram or lower. And mood swings in LDN, I think that it's possible. What happens is that when LDN does the endorphin blockade, I think it is possible to feel really bad or really depressed. Um, I think that, and I'm seeing more and more per people's experience that LDN appears to have interactions with serotonin pathway or modulations with it and dopamine pathway. There's no evidence done, but no evidence doesn't mean it's not possible. It just means that there's no evidence. So the next one is, and this person is on 2.5 milligram, and the person's not feeling happy and wants to go back to 2 milligram. I think that it's not a bad idea, or take a stop and start at really low dose. I think is possible. A question about morning or evening, I think really depends on the side effect profile. If you're not having a side effect, either way works. But if you're having side effect of insomnia, definitely take it in the morning. If you're having side effect of fatigue, definitely take it in the evening. Headache, I don't know what to say because I think maybe with lunch might be good, but really, all issues, I would say to my patients to stop and then restart. And I think that uh, and I just had someone say that they're taking 4.5. It's not, and it doesn't feel like anything. So the condition matters too. What kind of condition does this person have? And if the condition is neuropathy, then in my practice I go 4, 6, 9, etc. So I think that it's it's important to know that LDN is individual basis, not like everyone has an ideal. When I say optimal dose, people say, "What is it?" I don't know. We have to find it, find the optimal dose, and find out. And if it happens, and what really the person should be doing is, you know, I know that people like pharmacies that just prescribe you or give it to you, but in the beginning at least, I think you should have a doctor who's an expert on LDN, and that makes a difference, I think. And then you discuss with that person, and that's what you should be doing. And if I told you anything else, Facebook would say that I'm in violation and they'll shut us down. So go talk to your doctor, and oh, so pain also depends on the what kind of pain. If it's neuropathic pain, um, now I'm going to talk about myself. That should be safe. I'm just sharing my experience from the Facebook AI enforcement robots. So I successfully made my nerve pain worse. I've not had it forever, but it says, "Honey, I'm here. I'm gonna come back and live with you." So I tried everything I can, but it didn't work. It started LDN, and I started too high. I know better, but I know that for the nerve pain, I have to hit it hard. So I took 6 milligrams, and I got all the side effects for 2, 3, 4 days, and then I started. I tolerated, so I went to 2 times a day, and the nerve pain is much better. So I would say, and the no, the fatigue part is really hard. I mean, I think people just think that, oh, LDN is like magic pill. It's gonna make all the problem go away, and it doesn't work that way. Usually, it's better for pain, better for, and nerve pain related. I think it works very rapidly. Autoimmune takes more time, more effort, and then fatigue is harder than pain. It's harder than uh, nerve pain, and in my world, you have to get to the root causes for fatigue. That's why fatigue is so hard. You have to look at how do how optimize sleep, optimize hormone, check if they have hidden infections, check their nutritional status, and then E, I call it SHINE program: sleep, hormone, infection, nutrition, and E stands for autoimmune. I know it doesn't start with E, but it ends with E, so I call it SHINE program. And you have to dig deeper and look for the root causes. And sometimes you can't find it. It really, and those cases, um, I love using the acupuncture oncology fatigue protocol. It really, really, really works well. So the other person said, "How do I know when to titrate up?" I have a video and it talks about this. By the way, you can look for my videos in YouTube, and it. I mean, I don't make new videos anymore because all the question so far I don't see too many questions that require a new answer. So, um, LDN Yunhan Kim, and then it says it used to work. I think that's the video. It stopped. So basically, it's this was one of the Q and A's, and take a look at that, and that should answer your question. I'm gonna just post it up, and then the other thing is that um, I would like you to consider to subscribing my channel because um, I spend a lot of time recording all the LDN related things, and some of them are not. Some of them are about root cause medicine, but I think that it's worth it because I love LDN because it's root cause based medicine, and part of root cause medicine, LDN is my cornerstone treatment. So it says that I'm how do I know when to titrate up? So the video talks about that. But when you notice that you're not having side effects and you're not having good desired effects, in my practice, I usually go up. But what you have to do is talk to your doctor. And I keep on saying it. Those places that have rent a doc and they talk to you, and they're not your doctor; they're pharmacies doctors. So they're not going to necessarily do it. Their job is to sell LDN, write the prescription, not to problem solve your problem. For that, you need a doctor. And I think that I know I sound like a broken record. Ask pharmacists, ask your doctor, because number one, Facebook will shut us down, and that's why we have school. And let me go ahead and put our link for school so that people can find it. And the reason is in school, the school SKOOL, they don't have a bot like Facebook, and I will stand by all the community standard that I know, but I think that it's not fair when somebody else, like our members, break the rules and the whole group has to pay for it. So that I think that is unfair, and just like probably everyone, unfairness is not really something that I'm fond of. So let me see if I can find more questions. Again, it says, let's see, LDN for post-concussive disorder or TBI or traumatic brain injury. I I don't have too many people coming in for TBI, but I do have a lot of people for dementia. I have a lot of people who have post-stroke cognitive loss, post-stroke uh, not able to move parts of the body or able to talk right or have difficulty getting the words out or pronouncing it is difficult. So all these are acupuncture neurology section, and I've had actually really fantastic. I wouldn't say luck, but I've had excellent results with these people, and whenever I use acupuncture for the long term, I tell them to consider doing, LDN, because LDN I think is really really, really wonderful tool. And I really think that you should consider coming to try the LDN. And for the idea of support, I always tell them that I have three reasons for using LDN. One of the reasons for using LDN is to protect the brain. One of the reasons for using LDN is to reduce neural inflammation, not just brain, but nervous system too. And then the third is lowering inflammation. So I think that LDN to me, it's no brainer. Which it's easy answer. You go ahead and do that. It says help. I'm on ultra low dose. I think we talked about that ultra low dose MCAS. MCAS or mast cell activation syndrome, in my opinion, is not a diagnosis. It is a process by which immune derangement is expressed. Let me explain. MCAS or mast cell activation syndrome is really it's real. It's real, and it is a diagnosis. What I'm saying is that rather than saying that's a separate thing, it's for me it's a condition caused by the root cause that's making that happen. So let me explain a little more. If you have Lyme disease, you can get MCAS. I've seen that. If you have mold condition, you can go into MCAS. Now with the post-COVID, people can go into MCAS. So the MCAS is like a commonality or common pathway. Either things either come together, or it's a place that you can activate it multiple ways, and you can go there. So there's a great question, immune modulator. So the mechanism, the person asking that sounds like a scientist. Uh, Min Jae-woo, would you happen to be a scientist or a clinician? But basically, the there's this idea that if you have LDN or low dose naltrexone, it does only one thing. It's not true. That's why medications have so many side effects. It talks to a lot of different things. For example, we know two that we know about. The idea is that if the um, LDN or naltrexone talks to opioid receptors, the mu opioid receptors. But it's also true that it can talk to other types of opioid receptors, not just very well. And very well in chemistry, biochemistry, what we're talking about, how tight does it bind, or Ka or K affinity, or how slow does it dissociate, Kd. So, and we also know that LDN works in toll-like receptor 4, or TLR4, and that is on the microglia. And the microglia is immune modulator. If you, like I've done talks before in LDN Research Trust, you can look for it. And what happens is that when microglia gets activated, it is very, very, very impressive. It just looks so angry, pissed off. And what it's doing is that it's pumping out all kinds of pro-inflammatory molecules in the nervous system and the immune system, and then it creates in the immune system, that's MCAS. In nervous system, it's total chaos, and that's the how it. So LDN is immune modulator. It's the same mechanism, toll-like receptor for glial cell on glial cells. It inhibits it from getting activated. Once it's activated, it's pro-inflammatory. By inhibiting it, it is anti-inflammatory. And there are very few things that are excellent neuro anti-inflammatory molecules that doesn't cause lots of side effects, and LDN is one of them. So, oh my God, Maria is here. Maria is she's one of our people that um, she is knowledgeable in how I practice root cause based medicine, and she is a big helper. And so he says, no, if the person's not having side effects but no effect, then he says, I think Dr. Kim raises the dose. And so It's true. That's what I do in my practice. But you need to talk to your doctor. You need to ask your doctor what they think about it. Listen, we also offer free LDN primer. Just go to our website www.ldn LDN support group LDN support group.org, and then ask for it. Contact us. So Alice says, does it work better if you use ketosis? Oh my God! So this is why I say um, subscribe to my channel, because there's a video on that, and then I'll upload it right now. And I'm so glad I did all these videos so that I can, and I got practice how to get this up quickly, because I look for it and then I answer it. Uh, so that's that. And so why does that happen? Why does LDN work better with ketogenic diet? Because it's ketogenic itself, diet itself is anti-inflammatory. It is anti-inflammatory, and it is really amazing effect. So I'm going to self-disclose experience, so the Facebook should be fine. I had autoimmune condition, and they gave me steroids. It did not make it better. It worked to make me fatter, but it didn't help me with the condition. So I took LDN because, oh my God, and I was 30% that LDN did not work. But when I took ketosis, I didn't even do it for that. So I did it for another reason. And then 6 months later, it's like, where did my skin condition go? It's it's like not disappeared, but very, very calm. Before it was very prominent. So I think the LDN is something, and our Maria has said, Dr. Kim uses methylene blue, corydalis, Chinese mushrooms, and special acupuncture technique. That's all true. Um, so somebody NLR, if you could just neutrophil lymphocyte ratio. So I think that this person is a very advanced user of integrative and functional medicine, but I I think that lab is really re- labs are really really valuable, but you have to know I treat people, not labs. So it's nice to have the uh, labs, but I don't rely on labs as much. CRP, ESR, cytokines, all that. But really, functional means that, just that, functional. Functional means that, is the person getting sick easily? Is the person has energy? Those are functional issues. So I'll give you an example. I had a patient that could not take off mask. This person would start coughing, get sick all the time, and then we use root cause addressing remedies. And that person, and what did we do? We put them LDN, of course. Anything with immune system, you can just assume LDN, 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 and LDN. So I started with that, and then I said, okay, we have to reverse your allergies. So we tested, and then there's a thing called allergy drop or slit, sublingual immunotherapy. So I did that, and the person got better. And that's all. That's also part of my approach with mold. Schumacher is a genius. He should get something like Nobel Prize. But I don't think that's the only way of doing it. That's one way of doing it. And if you can understand it, so here's a great example. MCAS mimics Sjogren's. My friend Sjogren mimics everything. Sjogren is really cool thing. But in my practice, again, I'm not telling you what to do. I'm not giving you medical advice. This is just the way I do it. It's because all the LDN is addresses root cause. So because LDN addresses root cause, I like LDN. I like LDN even better than ketotifen. And I will start LDN on my patients, again, my experience, not medical advice, 1 microgram. And then we march up from there. And then I will use ketotifen, not the standard dose, because anything once you're in entered MCAS state, not a diagnosis, but state, when you enter the land of MCAS, anything can set it off, including aggressive LDN dosing, including aggressive ketotifen dosing. So my dosing is non-aggressive. And then everyone, I mean, I will get phone calls from pharmacies. They say, "Hey, your dosing is all wrong. It's just way too low." And that's that's really it's true. It's low, but there's a reason. People have MCAS, and to me, MCAS it signals that there's an immune derangement syndrome that it's looking for a reason to get pissed off. It's like dealing with a friend who is very easy to get mad. So you have to kind of walk on ice, or thin ice with them. So he says that ketotifen, LDN, yeah, yeah. He says my symptoms exploded after antibiotics, mold surgery. Yeah, yeah. That's exactly what I would have. And of course, you would have dysbiosis and SIBO and all that. So the thing is that that's why what I tell people is that when people have MCAS, they're just giving you a warning. MCAS means that you have to. There's a story about cooking a frog 1 degree at a time. That's MCAS. That's how you deal with MCAS. You don't do a frontal assault. What you do is you create a siege of your own. LDN go first. Ketotifen, if tolerated at very low doses. Chromium sodium, again, very low doses. And then methylene blue, very low doses. Ketosis, if they can do it. And the whole idea is to make treat the underlying condition and do it slowly, gently. And I know firsthand because unfortunately I had two family members with MCAS, and it took 10 years to reverse it. Now both of them are in remission. But if you and that's why I like I'll drift a little bit. I have a 99 member capped practice, and I'm not looking for more MCAS patients. Treating cancer patients is easier than MCAS patients, and it requires a lot of trust on their part. So I don't like taking them on. I think that they get SIBO is the same way. Um, I educate them, and I created all these Facebook groups not because all these people want to come. When they're interested, I say go visit it, read everything, and then I quiz them. If they fail the quiz, I just say, I don't think we're ready to work together. You need to educate yourself more, because by the time they come to me, they've seen a lot of people, and inevitably they feel lost, they feel angry, they feel like some of them really feel like swindled even, and I've seen that some unethical people charge large sums of money and extract it from them. Um, so the next question um, is like the person who wrote about all these things, MCAS, and then there is mold surgery, antibiotics. Oh my God. So if the person is not in the US, I can talk to you guys on video. I do that Saturdays at like 8 o'clock, 8:30. So if you're interested, you just contact me. How do you contact me? You contact me through or you can contact me through the LDN group. But this is where I do. I also educate doctors, nurse practitioners, PAs who want to learn this medicine that I do, the root cause medicine, one-on-one mentorship. And then the other person said they're very happy about LDN, so grateful for LDN support group. Does it work indefinitely? Do you eventually have to stop it? I'm seropositive. I'm gonna guess it's rheumatoid arthritis. Uh, where did the comment go? Oh, here we go. Um, and it said in remission for 6 months. So I'm so happy for you. I'm very happy for you to have the remission. I see it. Now, having said that, you're sharing your experience. I'm sharing my experience. I'm not saying that it will happen to everyone. So I want everyone to be clear that it does happen. I have seen it. You can't count on it that way. I always say about third of the time LDN works like miracle. Third of the time you have to work for it, and third of the time it just does not seem to work. And I had a case of a patient that with the MCAS, um, the person was really dying of discomfort from MCAS. She said, "My skin is burning," and so I put out the fire by fasting, but I did send her to allergists, and they had a new medication that is doing wonders for this person. I know what's going to happen. You know what's going to happen. Eventually, it's going to stop working. So this person's question is, does it work forever? I don't know, but anything with immune system, you need to stay on it for 5 years. Allergy drops 5 years. Cancer, we don't say cure, you say in remission, 5 years. I recommend people stay 5 years on LDN when they get their remission, and then live in ketosis, and then get off LDN. So I think that's okay. But of course, it, the condition can come back. Once the condition comes back, it's not going to come back the normal way. So I do want to share that I do have a service that I talk to people outside the U.S. Mm, I guess like a navigator, educator, health navigator, because I don't have license in outside the few states I do. Okay. Oh, what a wonderful question. Is MCAS symptoms or cause? So the way I look at it is the cause of the MCAS is immune derangement. Immune derangement is expressed in the state of MCAS. Immune derangement is the kidnapper that brings the body of the person to the land of MCAS. While you are in the land of MCAS, the symptoms and everything that will behave like a disease of its own. But why is MCAS so difficult? Because it's so easy to treat the symptom, just like modern medicine. And MCAS makes it very, very easy to get distracted, multiple symptoms. So unless you really understand root cause medicine, you're not going to do root cause medicine. And then you're going to be chasing the symptoms, chasing the symptoms. And it only took me 20 years to realize this. So you can understand how worthy of adversary MCAS is. Really, really amazingly smart, a tough opponent. But I see it everywhere. I see it in mold, I see it in Lyme, I see it in long COVID, I see it in auto derangement, other auto derangement symptoms. So, do you recommend the person? I'm going to pick on this person. Are you crazy? Are you trying to get us banned from Facebook? You're trying to force, like, ask me medical advice. So, I'm going to say, please do not ask medical advice. That can get us, the group, banned by Facebook. You can say, what is your opinion? What is your experience? Is a good word. So I will read it out loud the way Facebook would appreciate it. In your experience, in your practice, do you use ketotifen or LDN? This is not I'm not asking for medical advice. I'm asking for your experience. And if you're asking for my experience, as for medical advice, ask your doctor. Ask your doctor. Ask your pharmacist who does a lot of this. In my practice, I like ketotifen, LDN, because it can be compounded to 1 microgram. Because if I start saying, can you please compound ketotifen at 1 microgram, I don't think I'll find any place that's going to do it. So, in my opinion, that is not a great way of approaching it. I think the better way of approaching it is as low as possible, and then add a second, third, whatnot. Um, so that's how I do it, and I'm not giving you medical advice, but that's how I do it. Again, if any of you are outside the U.S., then I'm happy to, you can contact me, and then Saturday at 8:30 or 8 o'clock, 8:30, we can connect by like video conference, and then just talk. Why is it only available outside the U.S.? Because the rules are really complicated, and I don't even know all the rules. But from my research, if I'm just talking to people, um, that's a little easier. Within the U.S., they treat me like someone who has license in all states but don't have the privilege to practice medicine. That's the way it was explained to me. Very unfair, but I'm not going to argue with that. So if there's no other questions that I see, I'm gonna go on and see if there are other questions. Can you mood swings? Yes, I think that's possible. Okay, this person is morning, evening. I think we talked about that. Side effects. Um, Unless people don't tolerate 1 microgram, I don't think that's, in my opinion, that's not a good reason to do it in my practice. But some people say it doesn't work, and then I never argue with people about if it doesn't work. It breaks my heart. So it says here LDN to address inflammation, pain, nerve damage, post concussive disorder. So I think it's a good idea to use LDN. Neuroinflammation is one of the reasons I use it. And then, so definitely LDN. And again, ask your doctor, but LDN I do is cornerstone treatment for optimal brain health. And if you get the idea that LDN is an important part of my root cause medicine, you got it. It is very important part of it. Why? Because it doesn't address symptom. It addresses the root cause. What root cause are we talking about? Calms down the immune system, calms down the nervous system, lowers neuroinflammation and inflammation. See? Root cause. And this is the fillers. You know what? If you don't have a problem with filler, you're fine. Whatever filler. If you have a problem, I would say find a place that put it suspended in olive oil. Don't take a chance. Because chances are, if you're allergic to one, probably it's possible you'll be allergic to more. It says, thank you for your time. Well, I'm grateful that you guys showed up. That's really, really, really great. And deranged the immune system. Okay, so you're getting that the deranged immune system is like a kidnapper that brings the person to the land of MCAS. While the person is in the land of MCAS, the person gets attacked all different ways, gets tortured all different ways, which is really terrible. When do I stop LDN prior to surgery? I think that you should. It's a great question. The LDN before surgery, I think it's again, talk to the anesthesiologist. It's very simple. Um, and if they're not getting back to you, then week is good. Week is best. 3 days is doable. And after that, really talk to the anesthesiologist. Somebody's going to be taking the call. So stomach pain, yeah, I think that again the fillers like Avicel. Once you have it, I think that you should go to the lowest dose, and I think you should try the. But talk to your doctor, talk to the pharmacist, talk. I mean, that's what I do in my practice. When I say you should consider it, you should talk to your doctor, you should talk to the pharmacist. It says, is there do people start at higher dose? And the person is not going to give me lower dose. Well, it's FDA not approved, and many things are FDA unapproved, but it is an FDA approved medication, and it is being used as off label. That's two are very different. So that whoever the person says it's not FDA approved, peptides are not FDA approved. They are for research and animal use, not for human consumption. That's what they will say. But LDN is FDA approved. It is off-label use. And if the people are using it off-label use, then, doctor, it's art of medicine, art and science of medicine. But you have to know the art and science of medicine. And for that, art, you have to practice. Science, you have to look up. One of my mentors said that the crisis in medicine is that it's not that doctors don't know how to read, that they refuse to read. So that's the problem. In California, they aren't allowed to use any other fillers. What does that mean? I, I don't think that's true because if you, I can't talk about specific pharmacies. By the way, that's why I'm there is I'm using the LDN support group in school because there are some things we cannot talk about, like pharmacies. But the pharmacy I use, that's the one we talk about fillers all the time, and there are pharmacies that I use in Colorado as well as in New Jersey. Um, but I don't understand that. So that's that, and oh my God, I still have 15 minutes, and then after that, we're done. But looks like we are. There has been like 30 comments, which is really fantastic. And let me see more questions. 0. 0.5 milligram is not considered low in my practice. It says anyone gotten results from zero point 0.5. Yeah, I get results all the time, even lower than that. I start most of my patients at zero point 0.1. Again, not a medical advice, an education, what I do in my practice. And Charlie wrote, go and start low, go slow. What a wonderful, wonderful, wonderful idea. Oh, great. Someone joined school. That's really fantastic. I mean, I just created it yesterday. And, we have, let's see, um, Charlie's here, Jill is here, and another person is here. And I will go ahead and approve them. I'm going to approve the other person. And then that's that. So we have 15 more minutes, and if you have questions, I will answer it. If you don't have questions, I think that I plan to be on here 30 minutes and 45 minutes, so that's really good. The other thing is that I'm going to probably starting next week, I'm gonna look at when the Australian people want it done, and maybe I'll start one in Australia, and that's gonna be probably Friday evening for me, and Australia and Saturday morning for them. It says, oh, another person. Oh no, I don't think so. You just maybe I gave you the wrong one, or if you DM me and you provide me with your what do you call with your email, I'll just add you directly. I know that adding is always an issue sometimes, so uh, just and then I'll just put my email directly here. So one person asked me, it's like, is this all I do? It's like, no, I have a real job, and I have my hobby practice, which is capped at 99 people, and I see patients two new patients per month, and then I have a one-on-one mentoring service for physicians and nurse practitioners and PAs, and that is also I only accept uh, one person a month. So maybe maximum of three, or I'll cut down patients to one doctor and one patient. Um, and then, I just am very, very grateful for the opportunity. But recently, my wife and I love Tolkien, Lord of the Ring, Hobbit. So we are writing a novel. We're creating our own world based on Dungeons and Dragons and Tolkien's world, and we're writing a story about for 8, 9, 10, 11, 12-year old boys and girls. So I do other things too. I don't just do this. As a matter of fact, today's the day to do that. After this show, I will check with my spouse. We're writing it together, so I'll check in with her to see what she says. Any other questions? All right. Thank you so much for your time to join me. And I know that we got 34 comments, and we have 34 uh, questions and answers that we kind of got to do, which is really fantastic. But probably 10 of them are mine. So, like posting everything and whatnot. Um, Thank you, everyone. And I don't know if one of our moderators are here. We also have expert contributors. And if anyone wants to be a moderator, let me know, because the way things are going, I anticipate that we will be one of the few LDN groups standing, and that is why that we're very strict. Is that, and I see those people who post things and then that are not compliant, and they go to other groups and post, and and I communicated with all of their leaders, um, and um, and I think they're also getting more stricter, also. And we are very fortunate. We have very capable moderators. Tori was a fantastic moderator, and I'm forever grateful to her. But if anyone wants to help out with moderating, I would love for you to consider that. It's very easy, and you just do it whenever you're here. I mean, we have expert group subject matter expert. SME is Tori. She's I'm grateful for her. And then we have Sherry, who's my nurse actually, who used to be my nurse, and she worked with me for 2 years, and she's really amazing, and she's a subject matter expert. And then we also have Madeline, who used to run her own group. Remember, I said that Facebook is going around and dismantling groups. I helped her to grow her group by factor of 2 or 100%, and then one morning it just disappeared. So we just have to really pay attention. So a live stream, I'm scheduling to do this 10:30 Saturday morning. That was the poll. That was Democratic poll result. They wanted to. They wanted it this way, and I bumped into coincidence. I think God incident, not coincident, but it could be coincident too. So again, thank you so much. I'm so grateful, and looks like Charlie, who is one of our what do you call moderators, wrote something, and in Root Cause Wellness Hub. I have a lot of groups. The big one is Root Cause Wellness Hub, and let me see if I can find that, because I'll let me go ahead and put that in my group. Root Cause Wellness Hub. Root Cause Wellness Hub. Right there it is. You know, this is really amazing because this is the group that I just created this morning, like an hour before, Facebook group, and there's almost 200 people already. That means that people are starved for this, and I think that that's really, really, really amazing. So this is a group called Root Cause Wellness Hub, and that's something that you can join. So, is there any other questions? Last chance. 9 minutes. Well, actually, we're over by 21 minutes. All right. But join me every Saturday, 10:30 Central Standard Time, and when people are showing up, and I will go as long as I can. And when there's not as many people, I'll just go over the questions, because through the week, I think there's enough questions to cover for 30 minutes, even when no one shows up. And what happens is that I can download this and upload it in Facebook, and you can also find this in Facebook. But I just put YouTube as a library of my videos. Okay, last chance. Thank you, everyone. Have a great Saturday. Have a great weekend.